Welcome back to another episode here on the Hard Hustle Podcast. Our next guest says you can't always change your story. You can always change your life. So, Dr. John, how you doing today? And I probably butchered that. You can always change your story. You can always change your life. You've been doing this for a very long time. You've gone from being a founder to just running a massive OBGYN practice to stepping back, man, and really making time for the family. Walk me through that transition. How many years were you steady just going at it, and when do you decide you needed to step back a little bit?
Yeah, it's kind of a long story, Efren. By the way, thanks for having me on. I think it's great what you're doing. For me, probably I've been in private practice OBGYN doctor for 28 years, almost 29 years, and about 15, 20 years ago, I noticed the changes of medicine. And my philosophy of life either is if you want to change, you got to get involved in the change. And so I realized that small individual practices of doctors, and it doesn't matter what specialty you're in, we're going to go away. And we have these big, large institutional practices or academic practices. So I went to my partner, because it was only me and one other person, and I said, I really feel like we have to be proactive with this. And I started with a room full of doctors, 8 people, who are all like my friends and colleagues. And I said, look, if we're going to be relevant in healthcare, you have to be big. And so I started organizing the local OBGYNs in Las Vegas, Nevada, where I'm from, and formed a practice called Women's Health Associates of Southern Nevada. And it started really back in 2007. 2009 was really getting momentum. 2013 is where we got a lot of momentum. So it's been going on for quite a while. But now we're a practice with 22 different locations around the city, about 50 doctors, and another probably 30 to 40 extenders, nurse practitioners, certified nurse midwives, PAs, and we are the second largest single specialty women's health practice west of the Mississippi. So there's one bigger in Oregon, and that's it.
So did you ever see life getting you here, the second largest? Like, that's big right there, John.
It's funny. My story was I am not an entrepreneur. In fact, when I was going to doctors and talking to them, I said, I don't have a business plan. I have a practice plan. Like, how do we keep our practices the way we want to and still be relevant in business? So now I've become a business entrepreneur, but that wasn't ever my intention. I don't have an MBA. It wasn't my goal. My goal was to take care of my patients and practice medicine.
And now you, like you mentioned, you still have this entrepreneurial spirit, but you're also being a granddad. How are you balancing both, man? And which one's more fun?
Well, of course, granddad's the most fun. I think the way I always say about grandparenting, you're way too young to even have this conversation with you, Efren, but is the way I talk about grandparenting. It's like your kids without all the obligations. Like, I don't care if they don't do their homework. I don't care if they don't brush their teeth. But
Not my problem.
Yeah, but yet I'm a grandparent, so I can make them do that if I want to. I can participate in doing that, but it's not the obligation. When you're a parent, there's such pressure. I always say your kids are always your hopes and dreams, and you feel a lot of pressure. I don't feel that with grandchildren. It's just pure love. I love them as much as I love my kids, but again, without all the obligations is the best way I can explain that.
I'm fortunate to have my mother-in-law here live with us, and she always says the same exact thing. Like, I love my daughter, but I really love my grandkids. Like, I could do this all day, and I see it with her. She would say, hey, listen, I'm home. I don't want nothing to do. Like, I love you guys. I'm going to go to my room.
Yeah.
And, grandma. And then what happens, I don't know if they do this to your kids, but they don't listen to us when grandma shows up. It's like we don't even exist. Like, we weren't there all day taking care of these kids. Is that what's happening to you and your family?
Yeah. No, actually, I think we find, I don't like the word balance because I think you never have balance in your life. I like to use harmony and rhythm. So I think, and I give my wife credit for this, that I think she really established a good rhythm for, like, when grandma's here, she's in charge. But when mom and dad come through that door, they're in charge. So I give her a lot of credit for that. I just think that the thing that's amazing to me is the closeness that you have, and I'm sure you see this in your mother-in-law, that you just have this closeness that not everybody has with their grandchildren. I was
Hmm.
talking to one of my patients, and she was saying that her mother has seen her. I think her baby was like 2 years old, seen her like three times, and I just can't imagine that. I want to be there. I want to be involved, and that's how I started that next transition in my life. And it hasn't been a hard transition, and that's why I say change is hard. Always change is hard. But if you're doing something that you love and you're passionate about, and that's why I say you can always remake yourself, you can always change yourself, and that's kind of my motto in life. I've had lots of different jobs, lots of different opportunities, and I've created some of them. I've fallen into some of them.
I hope you're not the granddad that every time you show up, you got a gift or something in your hand to pass
I'm,
on to the grandkids.
I'm pretty bad. I'm pretty bad about that.
I
But
have to
what
tell
my
my mother-in-law.
my daughter did train me, Efren, that like I used to give them money every time I came, and like she's like, no, you can't do that, Dad. And I would just put it in their piggy banks, and they would raid their piggy banks without my daughter knowing. So I set up savings accounts, and they have no
Okay.
idea. They have no idea I'm putting money in every time I come visit them because I come once a month to come
Yeah.
visit them.
That's funny. And I have to yell at my mother-in-law every time. I'm like, they didn't even have a good day. They were not even listening all day. Okay, I have a 1 and a 4-year-old, so just imagine.
Yes.
They just feel like, oh, it's okay. I mean, grandma got us, and that's exactly the kind of the life that we're living is that grandma got us when she shows up. But no,
Yeah.
man, I'm excited. I'm excited that you're in this part of your journey, right after all this hard work. And you've also said that purpose evolves with every stage of life. What does purpose actually look like for you right now, as you're mentioning being a granddad?
So I'm really pursuing two passions. One I've had for a long time, and that's mental health. Um, I'm working with a company called Daylight Health, and I'll give them a plug. Daylight-health.com is their website. It's not something you can randomly sign up for. We have to sign up the physician practice, and then they use
Mhm.
that for mental health for their patients. So it's mental health delivered through a primary care doctor, internal medicine doctors, family practice. We're just actually meeting with an oncology group now. So people who are doing primary care of people in stressful times of their lives. And what this company does is they provide therapy services, and the doctor who they provide it for can bill for that under something called the collaborative care code. I'm getting too deep into the coding and stuff, but it's important that it's done through the doctor. So if a patient's interested in this, they have to convince their doctor to sign up for it. And there's a way through the website for the doctors to sign up. So mental health has been a huge passion of mine. Before I went to med school, I was in a master's program in counseling. Um, and I feel like when you're a good OBGYN, you're part therapist to your patients as well as their physician. So my patients will tell you I've been helping them mental health wise for 28 years, 29 years, and then the other passion is my grandchildren. That's a relatively new one. My oldest
Mhm.
granddaughter will be 12, and it changed my life to have them. And as I was watching my wife, who was going back and forth between, we go to my grandchildren in St. Louis, and we've always lived in Las Vegas, and that's where my kids grew up. My wife started spending 3 weeks in St. Louis helping with daycare and all that, and then I would go once a month for a weekend, and I kind of was jealousy is the wrong word, but it probably was a little jealousy of the relationship she was forging with our grandkids and that closeness. And I
Yeah.
just I just realized I gotta, and they're my only grandchildren. I have four kids, but only one of them has had children, and so I just said I got to do this, and that was important. So those two passions, my grandchildren and my mental, that's what I'm focusing on. And I still want to be there for my patients. So I still, in a limited schedule, I see patients 2 weeks a month, and I just see my old patients. So I'm not in this podcast trying to hustle patients or sell something. Well, I guess I'm trying to sell Daylight Health, but it's more just finding things that really move you, and mental health does, and obviously my grandchildren, and that's to me. I certain things, like I said, I don't like to say balance. When people say follow your passion, sometimes your passion, you don't have the skill set for it. I would love to be an NBA basketball player. I never had the skill set for it. And so, yes, or music, like say that your passion is music, but you don't have a great voice, So,
Yeah.
so I would say that's always makes me nervous. Is so follow your passions that you have an ability and a skill for. So,
I love it. We've my wife found a great OBGYN after failure of some as well, but we found this one, but he seems to always be so busy. Like this dude's schedule is just jam packed. So it seems like I'm almost talking to him like a replica of him. I can only imagine that at some point you were just that busy. Everyone wanted to talk to Dr. John because, as you mentioned, I'm not just the OBGYN, right? And I help them other ways. And that's actually good that you see that because some people just look at it, I'm just an OBGYN. And
oh
I'd say
yeah,
that because we had an instance where my wife had a miscarriage for our first child. And if you would have just seen how bad this OBGYN was, like he came in and just kind of like, you lost it. Sorry. Go ahead and clean up and go. And, my wife's in tears. This is during
hmm
pandemic time as well. So it was like I couldn't really be in the room. Luckily, he had a good assistant that came out after she seen how broken we were and just kind of gave us a little bit of love and gave us a hug. It's going to be okay. And I'm like, the doctor just didn't care. And I'm
I
pretty sure it's just probably repetition, but what a bad experience that was. We never went
Efren,
back,
I
obviously.
could do a podcast on that. Okay, like I used to always say to my staff, just because you do something every day, this is the first time this has happened to this individual. And I
Hmm.
always joke's the wrong word when you're talking about a miscarriage, but I always say women bond with their pregnancies when they see the plus sign on the
Hmm.
pregnancy test. And it is devastating to lose a baby. It is a loss no matter what. People will always try to compare losses if you had a stillborn versus a miscarriage. I
Hmm.
don't I don't get into that. I don't get into comparing tragedies. You shared with me you've had a challenging life, but you
Hmm.
you you don't compare tragedies. You embrace everybody when they're having a tragedy. You give them love and support. I cry with my patients when they had miscarriages. You have to understand, Efren. I really don't like where medicine is going now because it's in some specialties it doesn't really matter if it's shift work. Like with an orthopedic surgeon, I just care that they know what they're doing and they're sober. Okay, uh, you know, but some you have to be about the relationship.
Yeah.
Pediatricians, internal medicine, family practice, and we're moving more to this shift work model in healthcare, and I just don't like it. For 28 years, well, almost 29, I took care of my patients even when I wasn't the doctor on call. So I would say I was on call every night for 28 years unless I was out of town. And even when I was out of town, I'd leave my phone on so my partners could call me if they had questions about my patients. But I loved that. And again, go back to this word balance. I didn't have balance, but I will tell you, I I loved the way I practiced medicine. I did not miss any significant events in my kids' lives, and I was there like when my
Yeah.
wife needed surgery and all that. I think that's the hard thing, and I wasn't great at finding that rhythm. And I give my wife credit for helping me find that rhythm of how to not like I was staying in the office when I first started to like 9 o'clock at night, and she's like, "No, you cannot do this. You got to come home and put the kids to bed and all that." I would say I was a crappy husband, but she stuck with me through all of that. But
I
try to
love
be
it.
better now, and that's kind of my one of my mottos: do better, be better. So
Yeah. No, you're right, man. But it seemed like you just had this passion. It wasn't just because it was just work. It was truly, as you mentioned, it was passion. It was out of purpose.
yeah,
And you just wanted to make sure you were there for those. And how cool is it that you're in this space? We can kind of go back a little bit to those early days. If we could talk about what was your original vision when you built Women's Health Associates.
really, it
Let's
was
start there because I have a question to follow up on that
yeah,
as
it
well.
was really just to protect being in private practice, like controlling your life, controlling your schedule. When you work for a large institutional practice, you end up they tell you what days you take off, how many patients. As you can tell, I talk a lot, and I can imagine some bean counter comes into me. You're talking too much. You need to see 5 more patients a day. I did not want that. I wanted a way to protect the way I like to practice, and that's the model we put together. And I have to say it lives up to that. It's good for patients and it's good for doctors because it's good for the doctors. It's good for the patients because the doctors are happier. I always say when you reach jerky doctors like you did, which unfortunately there's a lot, I always say there's three things that they probably why they become a doctor. One, for the money. Two, for the prestige. Or three, to make their mom happy. But they don't really love medicine and love caring for patients. And
Yeah.
and I think everybody deserves that in a physician, somebody who cares about them. I used to talk about this with humility for my kids. Even if you're not humble, pretend you're humble, act humble, and it's the same thing. Is this is the first time people are going. Even somebody who has a lot of children, somebody who has 5 kids, they only do it 5 times in their life. So everything is significant. And that's the important part to remember as a physician. When you're doing surgery on somebody, this may be the first surgery they have ever had in their lives. And it might be your fifth of the day, but it doesn't matter. It's their first. And you
Yeah.
have to respect that and understand that.
I love that. Is this why you also it was very important for you to have that OBGYN practice led by a woman because you just felt that they
Yeah,
understand a little bit more?
as I was starting to make my transition, I think one of the things when you're born with privilege like I am, middle class
Hmm.
white male, okay, middle class white heterosexual male, I'm as privileged as you can be. Um, you have to recognize your privilege and help others gain opportunity. Um, and so when I was looking for somebody, I just earmarked I want a woman to lead the practice. I'm still very involved. My title for Women's Health Services Nevada, Southern Nevada now is founder and chief strategic officer. But the doctor who took over me, she runs the day to day. She deals with all the crap, which I don't have to deal with. So she does a great job, and I felt it was important to be led by a woman when you're a women's health practice. Now, I always say your sex does not guarantee your intelligence, your compassion, your how good a job you do. So, you don't give somebody something if they don't have this skill set. It goes back to, if you have a passion for something but you don't have a skill set, you shouldn't do it. I would be a terrible rock star.
When you stepped away, how long did it take for you to kind of be at ease with it? 'Cause I can imagine when you gave up the keys to the head of the table and you took a step back, there's some challenges maybe some like, what am I doing? Is this the right decision? Did you encounter some of that?
I didn't, and that's the odd thing because I'm
Really?
a crier. Like I'm an emotional guy, and the two main hospitals that I worked out of, they knew I was doing my last deliveries of my patients, and so they did some special things for me and stuff. And I came home to my wife and I said I didn't cry, and and I just meant I'm ready for this next phase. I One of my patients said to me because I'm also a communicator, so I was sending emails out a few years ago. I'm starting to slow down and all this, and then I sent the final email says I'm stopped going to take new patients, and my last delivery was March of this year, and and I felt like that preparation of preparing everybody for it because like the worst thing can happen to you is you really like a doctor and all of a sudden they just close their doors and they move away. So I'm a transparent, like I said, lay everything out on the table kind of guy, like I
Mhm.
am right now with you. And I think that helped. And one of my patients said to me, she goes, Dr. Martin, you've had a great run. And I'm like, oh, gosh, you sound like I'm dying. And I said, but the truth is, I have taken care of women. If you go back to residency for over 30 years, and I've made it my heart and soul and hustle to with your podcast.
I
Uh,
see. I hear. I
yeah,
hear.
and I'm done. I'm okay with that. And it's been hard because some of the patients say, "Oh, people I've taken care of since they were teenagers who are now pregnant," and they beg me, and I said, "Look, it's just time. It's time for me to go to this different phase, and that's why I'm getting involved with being more present with my grandkids, and also getting involved with this mental health company."
This is going to have something to do, but maybe not. But because I'm a wrestling nerd, I'm gonna just add it. Do you know who the Undertaker is?
Of course, I know. But I
Okay, I
I
just
don't. But I don't like Efren. I don't like violent sports other than football. Like
Oh my God.
and WOE is theater violence, so that even
Yeah,
like
yeah, yeah.
makes it, because I think you never want to fill crazies with notions, okay?
Yeah.
And you don't want to feel crazy that you could actually jump off a bar and hit somebody over the head and they survive, okay?
Yeah.
Like they do in WWE. I'm not sure those guys survive though because they end up bruised and battered and
Yeah.
dying young, as
Now,
we just lost Hulk Hogan. So
yeah, nowadays they protect the athletes a little bit more now, but yeah, back then Undertaker, Hulk Hogan, man, they weren't being protected. Those guys were years and years broken. The bodies were broken. They were still going out there and putting their bodies on the
well,
line.
and they
No, I
were
say
they were encouraged to abuse steroids too. So
that too. Yeah,
yeah.
yeah. So definitely different times. But why I say that is because someone just asked the Undertaker at one point. He put his hat, he put his boots in the ring, and someone asked, "How much money would it take for you to get back into the ring as the Undertaker?" And he's like, I'm not that guy anymore. I'm Mark Calloway. Like, you cannot pay me to go back because that was my legacy, and I don't want to ruin it. Like, I know that I gave it all. If I go back and it sucks, then what? That was
Yeah.
part of my legacy. So I feel like that's you. When people are asking you to come back, you're like, my legacy's done here, man. I'm on a grandfather mode now. I'm doing different things. I don't want to go back and mess something up and that be what people look at me for. People are looking at me for the good and what I've done. Is that kind of the space that you're in the Mark Calloway Undertaker days?
Yeah, I mean, listen, I always say money can change everything. Okay, because somebody comes up with enough. That when we were kids, would you take a punch from Mike Tyson for $10 million? Yes, I would. Okay, I'd have to rewire my jaw and all that kind of stuff. But
Right. I have enough
10,
money to do so.
yes, but it's interesting because one of the things that prompted me to make this decision, I have a friend who's a general surgeon who's a few years older than me, but we were colleagues. We had been in residency at the same time together and stuff. So, good friend. And I didn't know this, but his dad was a general surgeon. He goes, "My dad gave me this advice. It is better to retire at the top of your game as a physician than be asked to retire." And that's kind of what the
Mm,
Undertaker was saying: is if you lose your strengths and your abilities, and you're not that same surgeon or same doctor that you were. And listen, let's face it, Father Time always wins. LeBron
mhm.
James, as amazing as he is losing to Father Time. He's
Yep.
prolonged it as long as he can. Tom Brady, you're in Florida, so I'll use a Tom Brady reference. But same thing. You can be this gifted person, but Father Time always wins. Uh, so I like that advice. I see doctors oftentimes hang on too long, and I know whether it's the prestige or the money, whatever it is, and we see athletes do that too.
Mhm.
And
Yeah.
it's hard to give up that, and so that's why I guess I'm a little proud of myself because I think I am making the transition better than I thought. And what I always say is you have to develop other identities. Some people see themselves only as a physician or only as an athlete. And the identities can be simple. They can be father, horseback rider,
Mhm.
golfer, whatever it is. Grandfather for me, I would say my new identity is grandfather, and like I said, getting involved with this mental health company. So it's important to always, and this goes back to growth, always grow, always change, always remake yourself because you can. You never know what life's going to throw at you. COVID was such an eye opener for everybody, and it's really changed the workforce. Um,
Mhm.
and it's made it difficult for employers. It's made it difficult for individuals and all that. But listen, anything that makes you think of your own mental health and yourself first is a better thing.
If the Heart and Hustle podcast has ever sparked any idea or made you think differently, do us a favor. Make sure to guys share this, post it on LinkedIn, or even text that nonprofit friend that you just have. Whatever works, this is what keeps the conversation going and allows us to just grow this community together. Seriously, we appreciate you. Yeah, I really love that you're moving from one space to the other, but I really want to also talk about you building this, man. You built something that that's outlasting you. How? What is the key? What is the secret sauce? People are probably watching this like, wait, I want to have a legacy like that where I can step away and it's still running on its own, and I'm still part of it in a sense. What is the secret sauce? Any secret sauce there?
You know, I think transparency, honesty, and hard work. Like I always tell my grandkids, you can be the smartest person in the world, but the most important traits to be a successful person are being
Hmm.
honest and being kind and working your butt off, work hard. Um, and I think that I created this atmosphere. We do have doctors leave us occasionally, but most of the time we don't. They're very healthy and happy in a protected space. I'm not trying to exploit them for money. That happens a lot in medicine. Happens a lot in a lot of industries. Is people will bring on young people and try to exploit them for their financial well being. And I didn't set up something like that. I don't get a higher percent. I maybe should have set up. I got a little higher percentage of the company, but I didn't set it up like that. That was naivete. That's when I wasn't the businessman. I know better, but I was never. It was never about me. It was about, like I said, having this dream for a practice pattern. I always tell people there's three things doctors care about most. One is control of their schedule. So if they can take off time when they want to take off time. This is what makes you feel like you're a private practice doctor,
Hmm.
not filing PTO and all that. So yes, you have to work out your schedule with your partners in your office. We call each office a care center, but you can take off the days you want to. I took off my kids' birthdays and the first day of school and the last day of school every year. Um,
Wow.
and number two, they want to eat what they heal. And what I mean by that is when you're up at 2 in the morning doing a surgery or doing a delivery, you want to know that the bulk of the money is going to come to you because you're the one.
Hmm.
First, I would say first and foremost in healthcare, there's a lot of people who got their hands in the pie who don't perform any service. And the patients would rather keep that money themselves or have their physician or provider get the money. And we have created a healthcare system where there's lots of people to take, and doctors, I think I saw this, are only like 7% of the healthcare dollar. I might be wrong on that number, but it's a very
Wow.
small percentage. But what you want to know is when you're up in the middle of the night and you're taking that risk, driving in the middle of the night and operating on somebody and all the risks that come with that, with medical liability, all those things, that the bulk of the money goes to you. And the third thing is, and this is interesting, but staffing, like control of your staff. Like if you have a good medical assistant who wants to be paid $1 more and you're willing to pay the dollar more, you don't have an institution or a structure that tells you you
Hmm.
can't pay that medical assistant $1 more.
Yeah.
So that kind of control, and that's to me what we're losing with institutional medicine. And when I say institutional medicine, it's the hospital corporations that now do private practice. In Florida, you have some big ones there. On the East Coast, there's Geisinger Medical Clinic. There's NYU Langone. In the West Coast, there's Kaiser and Sutter Health. And we even have our own large institutional practice called Health Plan of Nevada or Southwest Medical in Las Vegas. And I think you lose control as a doctor. And so I wanted to, and academic centers like USC and University of Miami, they create these institutional practices that I feel like the doctors lose control. And I think when you're young and you're dreaming of being a doctor, you dream of the control. So that's what I built with Women's Health Associates of Southern Nevada is you run your life, you run your practice, the bulk of the money, there's administrative and management fees, but the bulk of the money comes to you once you've paid all your bills for running your office. So it definitely is that old private practice feel that doctors had 40 years ago. The money in medicine isn't what it was, but it's still good and it's still a great profession. I don't want to be one of these doctors who ever poo poos, and I loved what I did, and I'm glad I did it.
I love the transparency. I love the transparency, even from a perspective of a man. When you said you're emotional, because I'm that emotional person as well. Believe me, I start here and just start to ball up sometimes. I'm like, why am I crying? Why am I getting emotional? So I love that you brought that up,
I cry at
because as
television. I
men,
cry at television commercials. Okay,
oh my god, if
my
it's
kids make
emotional
fun
enough,
of
if it's,
me. So
yeah,
I
if it
said, "Isn't
touches
it
me
great
enough,
you've had a
man.
dad you've seen cry? Because some people don't have a dad they've seen cry." So
I mean, I didn't have a dad at all. So guess what, Dr. John? Yeah, I wanted to see my dad cry, or hell, I wanted to see him present at least, but
yeah,
they get to see dad present and cry. That's a
yeah,
plus.
that's
No, man.
good.
Another thing that you mentioned that I thought was really good. And I love how honest and raw you are. You mentioned how there's two most important traits in the world right now, hard work and kindness, and you're not really seeing that. You said we've lost our kindness. What do you think leaders can do to bring back that kindness?
It's something I'm super disappointed in our country right now. I always say, "Make America kind again." Forget great.
Mm,
America's great.
mhm,
America's always been great, and we could have discussions about that. But what this current administration thinks great is, to me, losing kindness. We are the land of opportunity, truly, more than any other country. But we weren't always the land of equal opportunity. And that's an important thing to remember. And we had set up things to try to help create opportunity, like DEI stuff and all that.
mhm.
And to me, we're losing that and we're becoming selfish. And I'll just frankly say, I think we have a selfish leader, and he models
Mhm.
that behavior. And and I just think that that's bad. He's very transactional. If you can't do anything for him, you have no value, and he casts you away.
Yeah.
But if he finds value in you, he'll bring you back into the fold. Your governor,
Mhm.
Ron DeSantis, I mean, he insulted him. And Ron
Yo.
DeSantis is still loyal to him, which I
Yeah.
just don't even understand. But so many politicians are transactional, um, and they again they lose their humanity, their kindness. Every generation of Americans since the beginning always had what I call the marginalized group, whether it be Italians or Irishmen or uh, Asian people who came and built our railroads and slavery and all this. And we built our backs on that. We did some terrible things, um, and we exploited and were terrible. And I'm not ever saying that's good, um, but we always resent immigrant populations, but yet we depend upon immigrant populations. And I
Mhm.
just don't understand that. And it's frustrating. And to me, we got to go back to being kind again. And again, what makes America great is our diversity and our learning from all cultures and not asking people to abandon their cultures like we did, you know,
Mhm.
hundreds of years ago. I just feel like we're going really backwards, and it's frustrating. And I think what I always say is, this is me. I know I didn't experience any of that. Okay, I grew up
Mhm.
very privileged, wasn't wealthy, but middle class family. Didn't want for food or clothing or anything like that. Um, and just again, recognizing your privilege and helping others who don't have it, and we've kind of lost that. And I think it's bad for our country because I feel like it's what our country was built upon, is people rising up. I think we should have done more to help people rise up. We shouldn't have oppressed. I mean, I don't get me started on all that, but the point is that we always, when times are tough, we always blame somebody of a lower stature, a
Mhm.
marginalized group, and it's not. I love. I'm a sports guy, and there's the new hot kid is a kid named Cooper Flagg, who got drafted by the Dallas Mavericks, and I love a quote his mom had. She goes, "When you're the best person in a gym, you need to find another gym. You don't
Mhm.
kick everybody out or all that. You challenge yourself to be better." So that's why I can say,
That is so
do
true.
better, be better.
No, that's really good. And again, going back to, I just love how raw and authentic you are, and which kind of led you to want to do more as well, right? So you stepped into the healthcare innovation because now we're in that growing space. What do you do now that you have so much time? It's like you bought back time, right, to do something different.
Yeah.
Um, what's driving that work, man? Tell me about that mental health startup that you're involved with. Why work through primary care doctors?
So primary care doctors, I feel like, have the best pulse of their patients, and especially good ones. Um, and you recognize, and I'm not talking about we're not delivering care. We'll help them get care, but people who really struggle with mental health issues, schizophrenia, severe bipolar, all of that. What we concentrate on is the anxieties and depression of everyday people that sometimes make them make bad choices in their lives, personal choices, drug or alcohol abuse. I feel like the root of most drug and alcohol abuse is mental health. And I think the primary care doctors have kind of their pulse on who needs it, but it was always hard to get the patient to it. The Affordable Care Act, what people call Obamacare, um, did three things that were really remarkable. One was keeping your kids on insurance until they're 26, because it's hard to find good insurance when you're 21. So that was a major influence and help for families. Number two is mental health is a required benefit. All insurance companies have to provide mental health benefits. The problem was there's a number on the back of your insurance card, and this is if you have insurance, because remember, a lot of people don't. And that's again a different podcast, but that you would call that number, and it would take people a while to get back to you in this time of need and all this. And this is where I credit the founder of Daylight Health, who she found this company off of the third part of the Affordable Care Act that I didn't even know about. So I met her. They developed what are called collaborative care codes, meaning a doctor can bill for a service even though they don't perform the service. Now, technically, that would have been fraud in any other aspect of healthcare, but because it's an Affordable Care Act law, that insurance companies have to cover this, and I can bill for mental health. Can't bill for anything else. Can't bill for physical therapy but I can bill for mental health. And so what Daylight does is they're the vendor to provide, and vendor is such a cheap word. They're the provider of the mental health services, but yet the doctor bills for it. That's why the doctors be involved. But the thing that I see most about it that's really incredible is you can get care to so many patients. I told the founder, I said, look, if I'm going to get involved with you, we need to hire a bunch more therapists because we're going to make this thing go. Because I see the need, and they have developed a structure. It's mostly virtual, where people can get a counseling appointment within a week or two. I had a patient walking out of my office and was called by the company saying, hey, Dr. Martin referred you for mental health benefits, and start that whole process. The other thing I like is, finding the right therapist is such an important thing. And they have what's called a navigator. And if you don't like your therapist, you don't have to tell your therapist you don't like them. You just tell your navigator, hey, I'm just not jiving with this,
Yeah.
provider. Can you get me another one? Because truthfully what happens is if people don't like their therapist, they just stop going. So they don't get the care they need. So I think accessibility and affordability, because these are all contracted insurance. Because what a lot of good mental health care providers do is they stop taking insurance and start charging a lot of money. So this is affordable and accessible. I really love it. And then they have all sorts of systems. They're directed by the chief medical officer, is a great psychiatrist. I'm a mental health passionate person, but I'm not a psychiatrist. So she's the expert. I'm just helping them grow the company and continue their mission.
As you mentioned, you're the strategist. That's your new role. You're just a strategist. You understand strategy. You see it from a different point of view. And with strategy, because what I'm seeing in the mental health space is, and I don't know how you feel about this, that people saying AI could play a huge, be a game changer in this. I hear people saying there's no way, right? Because it can never be that human-centric people that we are. However, I speak to a leader that she says she learned ChatGPT from her own child because her child uses ChatGPT as a therapist. So what is your thoughts on it? We talk about innovation and growth, man. Kind of in some challenging times because we don't want people to completely use a ChatGPT, still kind of go and call in. But I love this space because I think you may have, as a strategist, you may have had some insights maybe we don't know. What's your thoughts on it, John?
Yeah,
AI in this space.
I think AI is going to influence all of our lives. And I just don't think we all know what it will do. I am about human connection, even if it's virtual. I feel like I know you, Efren, and we've only talked twice.
Yeah.
Like I am for human connection. Um, and we both know that an AI generated answer will sometimes not be correct and best for that person because there's subtleties in language, in facial expressions, and all of
Hmm.
that. AI is not going to see that. But do I think there's a role? Yes. And I think anything that encourages people to take care of themselves, a big thing I always say to my patients is make yourself a priority in your life because when you're happy, everybody else in your circle is happier. So I'm not a get off my lawn old guy on many things. So to me, you have to change and recognize the value of things, but it's not the complete value. It's not
Yeah.
everything and anything. So
Yeah. Sharing to what you were mentioning about therapists. So, my first therapy session was actually via telehealth, and that was my first and last for some time, for some years, actually. And the only reason that I ended up going to see a therapist in person was because as I became a father, I think I told you I was adopted, I was sexually abused. So, when I became a dad and realized I'm a dad now, right? All these memories start to really come back of what it, my life was, and sometimes just kind of almost overwhelmed or feeling emotional because I'm like, I'm not going to repeat this cycle. Like, these are the things I was telling in my head. And I remember just breaking down one time, and my wife, because she became a mom, she was still in that postpartum stage, so she was seeing a therapist for that. And she sees me just break down one day. She says, "Hey, I have a session today, but it seems like you may need it more than I do."
good
And
for
sure
her.
enough, I said, "You know what?" And I'm a false. I'm just like you, man. I'm very transparent. I
Yeah.
like, all right, whatever. I'm going. And I tell you, I only went to her one time, but I speak about this lady like she's still my therapist to today, because she was so good. And I don't know if it's because I'm the person that loves interactions in person. I love that. But I also feel like the virtual, she just didn't care, right? She wasn't going to turn on her camera. Oh, I had something today. And it's like, well, we were scheduled for today. So all these flags already made me feel like, oh, I'm not going to do this. And I just never did it again until years later. And thank God that I did. So I love that you're in this space, and I love that you guys are finding ways for people not to have that one, like, hey, I don't like you. I don't have to kind of say that to you. I just find someone else. That you guys give people that option, because I
Yeah.
don't know if I don't think I had that option, but if I did, it would have made an easier transition, and maybe I would have kept on that lane. So
So
kudos
I
to
think you
that.
touch on a lot of things. I think finding the right therapist is important and having that connection. And I always tell people
Hmm.
you got to give it 2 to 3 visits, but if you don't get connected, then you're not going to get connected. And going
Hmm.
back to the way I practice medicine, you have to care. If you don't care, and maybe
Yep.
that's what I should say is another thing. If you don't care, then don't do your job. Okay.
Correct.
Um, but it's funny because I've been having this conversation that I think in larger cities where we have a greater patient load, we need some inpatient therapists as well, or sorry, in-person therapists as well, um, so people can have that option. But I do find that a lot of people connect through the virtual. But you're right; the person has to care and show that. Um,
Hmm.
Listen, we all got stuff. Like I believe everybody needs a therapist. Some people got more stuff than other, and you don't compare stuff. You don't say I had worse trauma than you and all that. We all got stuff, and I believe everybody should have therapy because there's always a low level. I didn't have the terrible issues you had, but I did have abandonment by a father, um,
Hmm.
and it made me this super intense, kind of like overly zealous father. And it wasn't until I went to therapy, and my wife would try to communicate this to me. She goes, they're going to fall and hurt themselves sometime. You can't dive
Hmm.
across a table to stop them from hurting
We
themselves.
try.
We try. And I just took that role so importantly because I didn't have that. But it started to
Yeah.
interfere, and it was almost like a codependency. And it wasn't till I saw a therapist that I learned that I need boundaries not only for my benefit but for my kids' benefits
Yeah.
as well. So we all got stuff, and it goes back to masculinity and what's masculine and what's not, and that's another thing unfortunately currently in our society. You like WWE, so masculinity is big strong guys who can kick your ass, and and that's not masculinity. Masculinity is being true, being authentic, and
Yeah.
frankly I love the Taylor Swift Travis Kelsey thing because I just see that whether it's real or not, I'm believing it, man. I think it's
Yeah. Same.
authentic. I think Travis seems like he's a really great guy. I'd watched their podcast even before the Taylor Swift because I think those brothers are very honest and feeling and good guys. I hope they are. People disappoint you sometimes. They say never meet your heroes. I remember meeting
Yeah.
Bill Cosby when I was very young, and he was one of my heroes. And before all that stuff came out, he was a jerk. And
Yeah.
so then that stuff came out, it didn't surprise me. And I had idolized him. I
Wow.
mean, he was my hero. And I happened to be working at a store in a local mall in Vegas, and he was headlining, and he came in, and he was just a pompous jerk, and it destroyed
Mm.
me. So
I don't think I've met a celebrity. I actually don't really like. I love celebrities from afar. There's probably one or two that I'm like. I'm a big Eminem fan. I grew up loving Eminem, so that's one person that I got to go to that concert. And I
yeah,
hope that if I was to meet this guy, that he's not this asshole. Because man, from a young kid, I remember being in my room, no TV,
yeah.
listening to a radio, Eminem posters, and that was my guy, man.
I think he was an
And it,
asshole, but I think he's become a good guy. Like I
yeah,
think
yeah,
he
same. That's what I'm
realized,
thinking.
at
Yeah,
least his music says that, like
exactly. This
like
music
being a
says that.
dad and being responsible and all that stuff. But I think he was. I'm sure you wouldn't have wanted to meet young Eminem. So
Oh man, back in my life, back when my young days, it's funny because who I am today wasn't who I was back then, and even as a man, when I was a young man and really getting my relationship, realizing that I'm still not, completely different people, right? There was so much anger issues, and I've had to learn that being in this relationship that there were so many things I was sweeping under the rug. So back then, I don't know, man, we probably would have vibed. Me and Eminem probably would have vibed. We were kind of in that same kind of broken phase, I would say. We were both in the broken phase, and I think he had a lot of healing. Being a dad, seeing what it looked like from his point of view. Same for me. I think a dad really being a dad really changes a lot the way we think and we maneuver. Especially my first little one was a girl, and maybe God did that purposely. He knew that I needed that girl in my life first to kind of even know how to treat a woman, right? I didn't know what that looked like. My mom was a single mom for 7 years, and I seen her in and out of relationships, but I didn't see a great man in how he treated a woman. I didn't have a father to show me how to treat a woman. So those are some of the things that I had to learn as well, man. But listen, we got to wrap up. We have to do another podcast because we could do this all
I
day.
could,
I ask you,
I
man,
could.
as you step into this next chapter, like, what do you hope your legacy actually in healthcare will be?
I think I already have one, like you said, and that's trying to protect private practice for doctors and let them feel in control and be relevant. And so you have to be big to be relevant. And we actually associated with a company that is headquartered in Florida, Unified Women's Health, who's kind of doing the same thing on a national level. And I love that. And I'm still working with that company as well as strategic advisor and all that. But then the other thing is, just making the world safe again and addressing mental health. I feel like so many of our ills in our society are due to poor mental health, and poverty. Those to me, those are like the things that we need to change. That's what we need to do to make America greater. There are some people who
Yeah.
need to be lifted up more than others, and you have to help them. And we all got stuff, like I said, we're all a little broken. You use that term, and I say that a lot. We're all a little broken. And so getting people help
Mhm.
for that. I just, again, trying to work for kindness, togetherness, appreciation. One of the things I say to my patients who have mixed race babies is I always say, you ever notice mixed race kids are beautiful? Like,
Yeah.
it doesn't matter what the races are. And I say, I think that's God trying to send us a message, get over
Yeah.
ourselves. And right now we are so ethnocentric and, just so
Yeah.
closed and resentful of people who are different from us. I really don't like that. It disappoints me a lot.
I I'm pretty sure you know who this is. So my daughter today, she had a bow on her head. She had a little hair coming down. She gave me very Macy Gray vibes, right?
Yeah.
And of course I looked at her. I love Macy Gray. I'm a Macy Gray fan.
Yeah.
So I looked at my daughter and I just like, oh my God, yes, girl, you look like Macy Gray. And some people look at Macy Gray and would think completely different. But I see beauty in Macy Gray because she is authentic. She is herself. That's who she is, and you can't change that. Since we've known Macy Gray from her early days, now she's still on tour. She's still the same person, you know.
Yeah.
So I try to even share my with my daughters, like, whatever you got on, you feel like look good, yeah. Because so many people will say differently. So I try to, as a dad, let my daughter know, be you authentically. People are going to like it, some people don't, but that doesn't change anything.
Yeah.
And I think sometimes we're so quick to judge because the person doesn't look like us, because the person, you know, has less than us or has more than us. And in reality, we shouldn't have to look like that. We all have a story. We all come from somewhere, and sometimes people are just also hiding things when they, you know, become very extravagant. But you know what it is? Still be kind to that person. I'm a big believer that one story, one person, one act of kindness could really change the way that someone sees and thinks and believes. So I love what you're talking about, is being kind to people, saying the hello.
So
Don't, you know, go
I
ahead.
would want to finish with this. COVID, we talked about essential people. And
Hmm.
what I say is everybody's essential. The guy who takes out my garbage working through COVID was essential. Just because he wasn't a healthcare worker or a first responder or a doctor, it doesn't mean he's less important. Everybody's
Hmm.
important. Everybody should be respected. So this is where being kind, recognizing the value, because they may not have had the same opportunity. They might be just as smart and just as talented as you are, but their opportunity. That's why I go back to, we're not the land of equal opportunity. And I would love to see us develop a system where everybody reaches their maximum potential, whatever that might be, you know. And they might be the best garbage man in the world. I could never be that good. And that's okay to
Yeah.
recognize that's their talent, that's their value, and that's their skill. So
I love
everybody's
that you mentioned that.
essential. So
I love that you mentioned garbage men. There's one in our neighborhood that I believe every holiday, every Christmas, probably every neighbor gives him something, a gift card or something. Because this guy's so genuine. He would take off his glove, pound you. Hey, how you doing, man? Even though it's just a little bit of time,
yeah.
makes a difference for someone, right? That enough that people was like, hey, what do I do for him and his family on the holidays? This man's just picking up my trash. You don't got to talk to him, but he'll roll up your trash, put it to the side of the house. Like, he sees my little daughter. Hey, you're right. I'm just a straight, you know, how cool. He takes a job very serious. You talk about caring. He cares for what he does.
Well, and
You know,
think
you can
about,
see that.
you're talking about what he does for you, but what do you do for him? You're
Yeah.
valuing him as a person.
Oh,
And
100%.
you don't say don't talk to him, he's a garbage man to your daughter.
Yeah.
You say he's important, he's a person. And how people treat people of a lesser station, I will judge you in the worst way if you treat a waiter
Yeah.
or waitress and somebody
I'm
you
with you.
deem as lesser stature. Because first of all, you don't even
I'm with
know,
you.
okay? But second of all, you just don't do that.
I'm a big believer on don't burn bridges. You never know when you're going to have to cross that one again. And sometimes that person that today is taking your order becomes the person that's actually interviewing the next time you go in for a job interview. And people remember that.
I know.
People remember how you treated them.
I know we need to stop, but Bill Gates said, "Be careful who you are on your way to the top, because on your way back to the top, you might encounter them again." So,
Yeah, it's true.
you never know what goes around comes around. It's like road rage. You could sit there yelling at somebody, flipping them off, and then you pull into the same parking lot, and you got a job interview with them. you
Oh
know,
my God, just imagine.
yeah. So,
Oh Lord. Well,
yeah.
listen, you're right. We do have to go.
Yeah.
Where can people find you? Are you on LinkedIn? What are the
So
socials?
I've Instagram, Dr. John OBGYN, and TikTok. I do videos kind of on everything. Uh, and then I'll be working with Daylight Health. There's no way to find me on that. And that's daylight-health.com. Just to hear more about it, encourage your providers to approach us and get enrolled. It's a relatively easy process for them to do. Um, and I think that I'm not looking to build anything. I'd love to build my TikTok and Instagram because I feel like I'm the antithesis of what I look like. So I would love to build that, but I don't want more patients. I don't It's not about my fame. It's just doing things that I feel like are important. I used to say I was going to run for political office, Ephraim, but then I figured I don't fit either party. So that's when I started TikTok and Instagram because I want to get in. I want to be an influencer, not in the makeup you wear, but how we treat people, and I don't want to sell supplements and all that kind of stuff. So
Man, you remind me of this gentleman. I met him. He was a, I guess he was a dentist, orthodontist, right? He was an orthodontist, and I met him years ago. And one day I'm on TikTok just scrolling, and I see it's now his name is Andre the Farmer, and I'm like, wait a minute, this guy's out here. This can't be the same guy. And yeah, man, he just picked up farming in his backyard. Now he has like 200, 300,000 followers, man, and he's still sometimes in his office showing his little greenhouse that he put in his little office. But he's actually also leaving as well. He's trying to sell the business. But it's cool how this guy was very quiet, orthodontist when I remember seeing him in the subway days when I used to work back at his office. And now he's on TikTok, 200, 300,000 followers. And something that he just wanted to pick up as a hobby became something so big. So now people are kind of, flooding him like, hey, how do you do this? How do you grow pineapples? Now he's getting his own sauce. Now he's, getting
that's
different
cool.
deals, all because of, the things that we love. So, John,
Yeah.
you'll be surprised, man. You think it's just you get on TikTok and then all of a sudden, boom, you're 300,000 followers in, and now you have another side hustle.
Yeah, yeah. I would love that just because I feel like I'm part philosopher, part doctor, so I would love that. So, um,
I'll leave you this last question, man. This is the blind question, and I curated this one exactly for you. When your grandchildren are grown and they tell people about you, what do you hope they'll say?
that I love them.
That's it.
That
That's it,
that
guys. What an
that
amazing conversation.
in every sense of that word, just enveloping them with love and you're making. See, I'm going to get emotional now. Love and safety and all of that. Um,
Yeah.
what I want to offer my blind question. If you're ready for that, Efren.
Go ahead. Go ahead.
So if you could pick a historical woman, because remember I'm an OBGYN, who might that be, and why do you choose them?
Okay. You came with a good question yourself, Dr. John. You came with a good question yourself.
All right.
Guys, this has been an amazing episode. Always a pleasure. I knew this was going to be a great conversation because our first conversation was really good, and I'm happy that we were able to record this one this time. But we thank you. If you guys are watching, make sure you guys do like, subscribe, share, tag someone that may need to hear these conversations. When we're talking about leaders inspiring the next generation, this is what they need to hear. They need to hear raw, authentic conversations. I always say social media does a really good job wrapping it, putting a bow tie, making it look good. But a lot of times those stories are not real. You can hear Dr. John that has been practicing and doing this, and still doing this for lots of years. So when we talk about the leaders, these are the people that you want to hear from, and find them on LinkedIn. Find them on social media. Now you got to go stalk his social media, or maybe we'll put it down there. Who
No
knows?
filter,
But
no
Dr. John,
filter,
thank you.
no filters either. This is
No
me.
filters.
So,
Dr. John, thank you. My name's Efrain. We got Dr. John. We'll catch you guys on that
thank you,
episode.
friend. Take
Later.
care. All right, bye bye.